What secrets lie hidden within the folds and crevices of the human brain? How do medical professionals peek into this complex organ to diagnose and treat disorders? One of the most powerful tools at their disposal is the magnetic resonance imaging or MRI scan. Today we delve deep into the art and science of reading a brain MRI. Understanding the different MRI sequences is crucial to interpreting these scans accurately. Let's start with T1 weighted images, or T1WI. These images are stellar for viewing anatomical details. In T1WI, cerebrospinal fluid appears dark, making it easier to distinguish between fat and white matter, which show up brightly. Moving on to T2 weighted images, or T2WI, these are particularly useful for spotting fluids and pathologies. Here, cerebrospinal fluid shines brightly and gray matter appears lighter than white matter, offering a contrast that helps in identifying various conditions. Contrast-enhanced MRI, gadolinium, highlights areas of blood-brain barrier disruption, useful for identifying tumors, infections, and inflammation. A special mention goes to fluid-attenuated inversion recovery, or FLAIR sequences. FLAIR is similar to T2WI, but it has a superpower. It suppresses the appearance of cerebrospinal fluid. This makes it easier to spot abnormalities near the ventricles, which might otherwise be obscured. Then there's diffusion-weighted imaging, or DWI. This sequence is a game-changer in detecting acute ischemic strokes by highlighting areas of restricted diffusion, essentially areas where water movement is hindered, which often indicates stroke. Complementing DWI, we have the apparent diffusion coefficient, or ADC. This sequence helps differentiate between true restricted diffusion, indicative of stroke, and T2 shine-through, which can mimic stroke on DWI. Lastly, let's talk about gradient echo, or GRE, and susceptibility-weighted imaging, or SUI. These sequences are particularly adept at detecting blood products and microhemorrhages, providing critical information in cases of trauma or stroke. Now, how does one systematically approach reading these MRI scans? First, always verify the patient's details and their clinical history. This background is essential for a targeted examination. Next, confirm the orientation of the images. Whether they are axial, coronal, or sagittal views, each offers unique perspectives and is crucial for accurate diagnosis. Examine the brain parenchyma. Differentiate between gray and white matter and look for any abnormal signal changes. Cranial nerves and orbits, check for abnormalities. Blood vessels, identify any abnormalities or vascular lesions. Assess the cortex for signs of atrophy, thickening, or lesions. The ventricles should be checked for size and symmetry, important in diagnosing conditions like hydrocephalus. Hydrocephalus, enlarged ventricles with thinning of the cortical mantle. Moving deeper, the basal ganglia and thalamus should be inspected for any unusual signals or lesions. The integrity of the brainstem and cerebellum is also vital, as these structures control many of the body's fundamental functions. Midline structures like the corpus callosum and the pituitary gland should be evaluated for any signs of disruption or masses, which could affect a wide range of bodily functions. Common pathologies have characteristic appearances on MRIs. For example, an acute ischemic stroke shows a high signal on DWI and a low signal on ADC. Look for mass effect. Check for displacement of brain structures, which can indicate an underlying lesion. Assess for enhancement patterns. Use contrast-enhanced images to identify areas of abnormal enhancement. Hemorrhagic strokes, on the other hand, have a high signal on both T1 and T2 in their acute phases. Tumors like gliomas often show irregular enhancement with contrast, indicating mass effect and edema, while meningiomas typically appear iso-intense or hypo-intense on T1 and enhance brightly with contrast. For accurate interpretation, always compare both sides of the brain. Look for symmetry. Correlate your findings with the patient's clinical information and cross-reference different sequences for a comprehensive evaluation. Review GRE-SWI, detect any microhemorrhages or calcifications. Use contrast-enhanced images. Identify tumors, infections, or inflammatory processes. Check DWI and ADC. Identify areas of restricted diffusion indicating acute ischemia. In summary, reading a brain MRI involves a detailed understanding of various MRI sequences and a systematic approach to examining the images. Each sequence provides unique information that, when pieced together, offers a comprehensive view of brain health.